Top 10 Unexpected Societal Issues from COVID-19. We are generally mindful of the bathroom tissue deficiency, loss of smell manifestations, veil necessities, and social removing decisions that accompanied COVID-19. These are some normal symptoms of the pandemic. In any case, did you realize the infection brought extra unforeseen results past its destructive side effects? We've assembled 10 issues that our general public didn't see coming. Number 10. Abundant suicidal thoughts and deaths. The progress from life as far as we might be concerned to isolate in the primary portion of 2020 prompted genuine emotional well-being issues. While considers report no general expansion in self-destruction rates, this isn't valid for explicit nations or socio-economics. Individuals have additionally guaranteed expanded contemplations of self-destruction. The Centers for Disease Control and Prevention, CDC, delivered a report studying 5,412 American grown-ups from June 24 to 30 in 2020. The outcomes? Members detailed raised self-destructive ideas. Specialists discovered guys were more self-destructive than females, utilized more self-destructive than jobless, and fundamental laborers with higher self-destructive ideations than superfluous laborers. Real self-destruction passings have expanded in non-white Americans contrasted with whites. An examination delivered in January 2021 found that while death rates in Connecticut diminished generally speaking, the level of passings from racial minority bunches had expanded. An alternate report dissecting information from 21 nations found that Vienna, Japan, and Puerto Rico showed factual proof of expanded suicides in 2020. A February 2021 investigation of self-destruction rates in Japan between October 2009 to November 2020 discovered expanded self-destruction during the pandemic. There were critical abundance passings from self-destruction between Japanese females and guys among July and November 2020. Thus, regardless of specific sources, COVID-19 has caused self-destructive outcomes in the public arena. Number 9. Abundance of porch pirates. The frenzy buy from COVID-19 and expanded customer shopping on the web has out of the blue prompted expanded yard privateers. The term patio privateer has been utilized since the mid-2010s and alludes to hoodlums taking bundles from individuals' yards. Toward the finish of 2020, Amazon declared a 72% more income than in 2019. That is a great deal of bundles individuals requested during the pandemic. In America, an examination study contrasting bundle burglaries in 2019 and 2020 revealed a 7% increment from 36% to 43% of bundles taken. For more itemized patio privateer measurements, 35.5 million Americans revealed they had a bundle taken in 2020, bringing about a worth of around $5.4 billion. Of these individuals, 36% said they had bundles taken more than once. Number 8. Overdrinking and alcoholism. Stuck at home, secluded, and stressed over the pandemic impacts can without much of a stretch lead to getting the container and drinking your concerns away. A few groups likewise accepted that liquor forestalls COVID-19. This supposition is inaccurate. The National Institute on Alcohol Abuse and Alcoholism, NIAA, needed to deliver a declaration on May 12, 2020, to remind individuals, drinking liquor doesn't forestall or treat COVID disease. Although a hand sanitizer contains liquor and a glass of wine can facilitate some pressure, drinking an excess of liquor can make your invulnerable framework more fragile against COVID-19. Research on 1,540 grown-ups ages 30 to 59 years considered the adjustment of liquor utilization in 2019 and 2020. The information from 2019 was from April 29 to June 9, and the 2020 information from May 28 to June 16. The outcomes tracked down that general liquor utilization expanded during COVID-19 by 10%. Nonetheless, ladies devoured more liquor by 41% more. Ladies additionally encountered a 39% increment in unfriendly results related with liquor. These rising drinking examples can be a likely indication of liquor misuse and fixation. Number 7. Managers with trust issues. Since 1999, when the web permitted organizations to contract telecommuters, administrators have detailed they experienced issues confiding in far-off representatives. Questions like, are they working the hours they record, were normal. So with COVID-19 constraining a larger part of laborers around the world to telecommute, supervisors are out of nowhere getting themselves undeveloped to oversee distantly also. The Harvard Business Review, HBR, overviewed 215 chiefs and administrators in 2020 to perceive how they dealt with distant workers. The outcomes demonstrated most were battling and detested the experience. For instance, 40% communicated low fearlessness in their capacity to oversee laborers distantly. 38% said telecommuters typically perform more terrible than the individuals who work in an office. 41% were incredulous whether telecommuters can remain spurred in the long haul. Number 6. Spread of touch deprivation. Indeed, contact hardship, otherwise called contact starvation, is a real medical issue. Actual contact is significant for people multiply, and disengagement joined with social separating has kept individuals from accepting the touch they need. Human touch can diminish nervousness, extend trust, and improve your well-being by improving your insusceptibility. An examination on premenopausal ladies found that embraces from their accomplices brought down their pulse. The overseer of the Touch Research Institute at the University of Miami, Tiffany Field, has connected the shortfall of touch to nervousness, sadness, and brought down invulnerability. In an alternate report, she tracked down that 68% of members felt like they were contact denied during the principal COVID-19 closures. This number expanded by 50% inside a month. Number 5. Higher domestic violence rates. We would expect additional time at home with your family as an energizing chance for quality time. Lamentably, aggressive behavior at home has been instituted a pandemic inside the COVID-19 pandemic. Notwithstanding the ascent of cases, another issue to consider is the failure to look for help during isolation. Individuals encountering private accomplice savagery, IPV, couldn't securely call hotlines or visit support places for administrations. An April 2020 report delivered in the American Journal of Emergency Medicine, AJEM, subtleties some disturbing aggressive behavior at home patterns all around the world. In the United States, police division measurements gave knowledge into how COVID-19 added to expanded DV. For instance, police recorded the accompanying information after March 2020, stay-at-home requests. Portland Police Bureau, 22% increment in captures identified with DV. San Antonio Police Department, 18% increment in calls in regards to family viciousness. Jefferson County, Alabama Sheriff's Office, 27% increment in DV calls. New York City Police Department, 10% increment in DV reports. The AJEM report likewise subtleties that the United Nations, UN, Element UN Women has worldwide insights of expanded DV cases. Models incorporate the accompanying expanding since the country's lockdowns in March. Argentina, 25% of cases. France, 30% of cases. Singapore, 33% of helpline calls. Number 4. More substance use and overdoses. Substance use is up, as are glut passings. In December 2020, a CDC public statement clarifies there were more than 81,000 medication glut passings in the U.S. from May 2019 to May 2020. The most noteworthy recorded excess passings more than a year ever. These detailed passings include 98% increment of manufactured narcotic included passings in western states. 26.5% increment in passings including cocaine. 34.8% increment in passings including psychostimulants, for example, methamphetamine. A February 2021, Morbidity and Mortality Weekly Report, MMWR, detailed expanded substance use in April and May 2020. There were 1,004 grown-up members and brought about evaluations of 18.2% of expanded substance use. Also, 36.9% of Hispanics portrayed expanded or recently started substance use during the pandemic. Number 3. Increase in physician burnout. With expanded patients with serious COVID-19 indications in emergency clinics, we may have anticipated the restricted beds and dependence on medical care laborers. However, how are the doctors treating every one of these patients getting along themselves? Insights say not all that well. Coronavirus expanded the responsibility on doctors and straightforwardly prompted expanded burnout. A Medscape overview delivered in September 2020 of 7,500 specialists around the world features exactly how terrible doctor burnout has become during the pandemic. Of the complete specialists, 5,000 rehearsed in the United States, and 64% of these doctors said the pandemic heightened their feeling of burnout. The principal explanations behind the pressure were treating patients liable to bite the dust and being presented to the infection without appropriate individual defensive hardware, PPE. A fifth of doctors in Spain and the U.S. said they wound up getting COVID-19. Unhappy and overworked doctors are risky society issues. In addition to the fact that we rely on doctors to be aware of managing their responsibilities, yet in the event that they choose to stop, an absence of medical care laborers can demonstrate deadly for those requiring their consideration. They can't all get away simultaneously, however our doctors need a break. Number 2. Overeating and obesity. Not exclusively does serious corpulence qualify you as in danger for COVID-19, however the pandemic is making individuals overeat also. Stress or enthusiastic eating is a typical marvel. Utilization of food can numb out undesirable emotions. Numerous individuals wound up acquiring as much as 15 pounds during self-confinement that the expression "isolate 15" began circling via online media. Loading up on food if there should arise an occurrence of restricted supplies and being near the kitchen storeroom at home all day perhaps added to this. Did you realize that overeating is likewise one of the exceptional results a few groups experience subsequent to recuperating from the infection? Indian news sources cited a doctor from the Apollo hospitals in Seshadripuram saying individuals who lost taste or smell during their COVID-19 ailment began voraciously consuming food after recuperation. During their 14-day separation after the ailment, individuals are putting on weight. Dr. Dinesh V. Kamath said, "We are seeing many recuperated patients in the age. Number 1, kids can't improve their immunity. Remaining at home and not being presented to the soil and contamination outside should make your children better, right? Not really. For small children where their safe framework is as yet creating, over-clean conditions can contrarily impact them. At the point when children play outside, and you open them to allergens, they will be less inclined to create asthma or hypersensitivities when they grow up. Isolate is denying little youngsters this insusceptible boosting opportunity. Notwithstanding, your more established children's invulnerability won't deteriorate by remaining inside.